Patel, your practice has been in practice for a long time. Your father created it, 20, 30 years now in a second. Tell me, what do you see is some of the most overlooked things dental patients do? What are some of the biggest problems they create more or less on their own? Certain things happen and they go on, and we all need certain work and maintenance eventually. What is some of the things, if they would do / take care of, they would need less dental care from a dentist, which is less money, less a lot. Tell me what that is in your viewpoint.
Sure. I'll tell you this. One of the most overlooked statistic from many practitioners in our field is 95 to 97% of North Americans do not floss on a regular basis. As the saying goes, an apple a day keeps the doctor away. It is my very true belief, and we have seen it over the many years that we've been practicing, that if a patient truly did floss once a day, they will keep the dentist away. Home care is extremely important. This is something that patients may or may not realize. The normal trend has become that, hey, I must visit the dentist every 6 months. Well, for a cleaning. Well, it's not the cleaning that the dentist is more concerned about, then it's mainly the checkup. Because if you think about the facts, out of the 365 days of the year, you're physically going to the dentist twice a year. The other 363 days is a lot more important than the 2 days that you go to the dentist. So the dentist, the whole point of those 2 visits in the year is, hey, let's make sure that things are well in your mouth. Not necessarily let me clean your mouth and let's get you going along your way. But when I say well, one of the biggest known dental condition, which is not in the top of any patient's priority, is periodontal health, which is the health of your gum and bone. And again, that stems from what I had mentioned earlier, the inability or ineffectiveness from a patient's perspective to doing this on a regular basis. I
see. So you said something here, and I've talked to many dentists, and they would say flossing like literally every time you eat, which in real life is very, very difficult. I for sure do not do that. But you say once a day. So if a person actually says, look, every day before going to sleep, I go and floss, you would say that goes a long, long way.
Absolutely. The regimen that I strongly believe in is, first of all, let me just say this, patients have been to dentists in the past. So when a patient comes to our facility, it's not assumed, but we do sit there and try and understand their history a little bit better. And, in this country, particularly in the world, we are more tuned to telling patients, hey, look, it is important to go to the dentist twice a year. It is important to floss. But, from a practicality standpoint, it's not as easy of a habit to get into. A lot of patients who go to the dentist, they're very much in tune and they agree that flossing is very important, along with the oral hygiene care of toothbrush and mouthwash. But they'll go back, they'll be motivated, they'll be excited, and a week or 2 weeks later it kind of fizzles away. So it's a habit that has to gradually be created. So my feeling is, yes, would I love for every patient to floss 7 days a week? Absolutely would. But it's something that has to gradually be created. Just as a habit takes about 21 days to be created. Flossing, in my personal opinion, should be done at least a minimum of 3 to 4 times a week. That is to begin with. If a patient can achieve that, wonderful. Now you can go ahead and step it up to 5 times a week. And then you can step it up to 6 times a week and eventually get to the ideal scenario of 7 times a week. It's not bad if you did it twice a week. It's better than not doing it all. But the general population tends to only floss when you have food getting caught in between your teeth, or some sort of a situation arises where there is a need to put a floss through. Creating that regularity should be a gradual process that should start, with at least 3 to 4 times a week. Now, that being said, when should a patient floss? It is my personal belief, and it is the practice's philosophy, that the best time to floss is at night before you go to bed. You should brush your teeth, you should floss, and you should use mouthwash right afterwards. What this does is, when we go to sleep, our saliva production very much is at a very minimal, if not, it is halted. Meaning your mouth does not produce the saliva. So if you have an excessive amount of bacteria in your mouth before you go to bed, and there isn't saliva flowing that keeps the bacteria off of your teeth, the bacteria sits where it wants to sit and does what it wants to do, which in turn over a gradual period of time causes issues. So it is best practice to brush at night, go ahead and use your dental floss throughout your mouth, and then rinse away all that loose particles that you've created with the floss with a very effective mouthwash. And there's many out there that patients can use.
So we can be a little bit in control. We can help a lot, and that's what you see. We ourselves don't do enough. Like in most things in life, services for many things become so good, so we become a little lazy and simply don't do them anymore and think, well, we'll just go and fix it with the doctor, the mechanic, the whatever it may be. And we just need to not do that. Thank you very much again. Very informative, especially actually that you give people a little leeway and say, look, 7 times a week would be great. Maybe even floss at lunch also maybe would be good. But start with 2, 3, 4 times, work it up. It is worth a lot, because sometimes when we think we don't do it all, we sometimes do nothing because we think, oh well, I guess it's not worth it, and that's even worse. So what you're saying is extremely good advice. Thank you, Dr. Patel.
Thank you very much.